Hi, I'm Mark from North Bay Animal and Bird Hospital. This is Alyssa, and this is AC. We're going to teach you how to give your animal sub-Q fluids. You have your bag of fluids. It'll be one of a couple choices that your doctor will give you. You have your line, and you have the needle that goes on the end. We're going to go ahead and put these together. You'll notice here on your bag, you have a slight notch in the plastic. That makes it a lot easier to open. So just go ahead and pull along that line. This will be garbage. You've got your bag of fluids. Alright, we're going to set that there. Now, this is your packaging for your line. You've got perforations along here that help you tear this. Right. You've got your line out. Now you'll notice on your line you have caps, plastic caps on both ends. That's to maintain the sterility of your line while you put your bag together. To insert this into the bag, you're going to remove this blue tab here, or it may be another color, maybe clear, all depends on the manufacturer. Just pull to do that. Now you've got this little hole, it's a tube really. You remove the plastic cap. Mind yourself with the tip of this. This is going inside your animal. You want it to be as clean as possible. You don't want it to touch anything else but the inside of the bag. Alright, got that attached. Now you'll notice on the line you have two separate fluid regulators. You have this one, which is a complete stop on and off. Push it all the way on, stops the flow completely. And you have this one, which helps you set your flow rate. Alright, you push it all the way down away from the L, and you've stopped the flow. Bring it up, and as you move forward, you're increasing the volume that you're giving your animal. Okay. Now, you have your needle and you have your other end of your line. Some of these have a plastic screw on, some of them have one that just slides on. So you'll have to look and see which one yours is. You remove the end of your needle, maintaining your sterility, put that on, and just screw it in or slide it on, and you're all set. Then we're going to hang our line up. Alright, we have our bag hung up, and you can do this at home either by using a metal wire hanger and bending it so that it fits your needs at home, and you can hang it on a shelf or you can hang it on any hooks that are on your wall or anything like that. You'll notice that there's a bunch of air bubbles in this line. We need to get those out so that they don't go in your animal. This is called priming the line. So what we're going to do is we're going to remove the tip of this. Always be careful with the needle so that it doesn't poke you and you don't touch it to anything else. You're going to undo your line stops so that this flows at the maximum rate. And all the while you're watching your fluid and you're watching the bubbles in the line, and once they're out, you just go ahead and turn that right off. Always mind the tip, recap it, and your line is primed. Sometimes this will fill completely so that you can't see how many drops are going. You can lift your bag upside down, squeeze gently, and it'll give you some air in there so you can see what you're doing. From here, you're ready to start putting fluids in your animal. Alright, at home, you can do this either by yourself, or if you have someone at home that can help you with the animal just to distract them or keep them in place, it is very helpful. At work, we usually try to do this with 2 people. You grab the skin, you're going to tent the skin, and then you're going to take a little bit of alcohol on either a cotton ball or a piece of gauze, and you're just going to wipe that area down to the skin. All right? Trying to keep as much of this clean and sanitary as we can. Always watch the tip of your needle. It has a bevel on it. You want the section that is open to face upward, away from the cat's or the dog's body, so that it does not occlude or block the line, so that the fluids will always flow. When you insert the needle, you're going to go under the skin with the bevel facing up towards the skin once you're inside. We're going to go ahead and grab the skin, pinch it, pull it upward a little bit, and then with one swift motion we go between the body and the skin. Real quick, that's it. They might whine a little bit, they might complain, but it really doesn't hurt them that bad. It's no worse than getting your yearly vaccination. Now that you have your needle inserted underneath the skin, you're going to undo your little blue clip here off of your line, and you'll be able to regulate how much fluid or how fast you want the fluid to go by this little L-shaped part right here, okay? So usually with sub-Q fluids we just open this up all the way, and then you'll watch your bag, and your bag has markers on it here. There's a 100, a 200, all the way to 1,000 milliliters. Alright? So once you've seen the bag lower from the current point of a full bag down to the 1, you've given 100 milliliters. Once you go down to the 2, you've given 200 milliliters. Now how much you give is all going to be depending on what your veterinarian advises you to give your animal. Alright, so then you take your needle out, put the cap back on, make sure that you don't poke yourself with that. Pinch the skin a little bit where you had it inserted so that and none of that fluid leaks back out. If you find while you're giving this that the skin becomes very tight, don't be afraid to move to another location where there's loose skin. Alright? You don't want that skin to get too tight. If you have any other questions, please feel free to go on tampabayvets.net and find one of our 4 locations and give us a call. We're more than willing to answer any questions. I'm Mark, this is AC, and this is Alyssa. We'll see you next time.